So the number of hospitals excluded from load shedding across the country has now increased from 37 to 72 since the last public announcement by Health Minister Joe Phaahla in September. The department says more efforts are being made to implement the exemption of health facilities in the Northern Cape as well as Northwest as a matter of urgency. We can speak now to the Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, very good afternoon to you. Grateful for your time. So 37 to 72 facilities now exempted from the power cuts. Good progress?
Good afternoon to you, Temegile, and to your viewers. Yes, we applaud the government, the Department of Health with the Department of State Enterprises for their intervention when it comes to exempting these hospitals, the healthcare institutions. As you know, electricity and water are like oxygen in the healthcare sector.
But the issue still is that the grievances raised, especially more pointedly in the Northwest, haven't been fully addressed, have they? Because the Northwest in particular felt sidelined even from the initial pronouncement.
Well, we are monitoring that space. We were also concerned that there are provinces, especially rural provinces, that seem to be sidelined. I think they are as important as any other hospital, so they need to be considered. We don't see the reason why they should be sidelined. I understand there's a criteria that is being used, looking at the patient numbers and all these things, but you know, on our own, we don't feel that there should be any hospital that is left out in this arrangement.
And I don't know, you were saying, when you were speaking to us earlier, you were saying what this could also do is that even in urban areas, what it may do is lead to an unfair distribution, shall we say, of patient numbers where everyone now has to go to one hospital. But what happens there is the staff complement, for instance, may not match increasing demand.
Yes, you're quite right, Mbegile. That's precisely the reason why people leave rural areas, you know, to go to institutions that are well-resourced. If you have institutions that are sidelined, it will encourage that phenomenon. So we would expect that government would fairly distribute, you know, electricity to places that deserve, and making sure that, you know, we don't overpopulate the city hospitals because there's no electricity in the rural areas. So it's quite important that you know, that process is taken into consideration speedily.
Dr. Mzukwa, thank you so much for your time.